Understanding empty sac pregnancy.
Hello everyone, and welcome to today's video where we're going to explore an important topic in the world of pregnancy, an empty sac pregnancy, otherwise known as a blighted ovum. It's a situation that can cause a lot of worry, but today we will discuss what an empty sac pregnancy means and whether it can progress normally.
What is an empty sac pregnancy?
An empty sac pregnancy, also known as a blighted ovum, occurs when a gestational sac forms and grows in the uterus, but an embryo does not develop. This often happens because the fertilized egg, though it was able to implant and begin to grow, had a chromosomal abnormality that prevented it from developing into an embryo.
Can an empty sac pregnancy progress normally?
The key question we're here to address today is whether an empty sac pregnancy can progress normally. The short answer is no, it cannot. In a normal pregnancy, the gestational sac should contain an embryo. When the sac is empty, it indicates that the pregnancy is not viable and cannot proceed as normal. This is usually followed by a natural miscarriage as the body recognizes that the pregnancy is not progressing as it should.
How is an empty sac pregnancy diagnosed and managed?
An empty sac pregnancy is usually diagnosed via ultrasound. It can often be a shocking discovery for expecting parents who may not have experienced any clear symptoms of a problem. Management typically involves waiting for the body to naturally miscarry, or medical intervention through medication or a procedure called dilation and curettage, D&C, to remove the non-viable pregnancy. It's important to remember that having an empty sac pregnancy is not a sign that you cannot have a healthy pregnancy in the future. Most women who experience a blighted ovum go on to have successful pregnancies afterwards. While an empty sac pregnancy can be an emotional experience, it's important to remember that it's not your fault, and it doesn't mean you won't be able to have a healthy pregnancy in the future. If you have any concerns about your pregnancy, always consult your healthcare provider. We hope that this video has helped to demystify the concept of an empty sac pregnancy and has provided some useful information. Remember, you're not alone, and support is available. Thanks for watching, and take care.